Is jaw pain or a headache at the base of your skull causing you constant pain? Discover what these symptoms mean and how to find relief. In this video, I will answer the following questions. How can I relieve jaw tension with a neck exercise? Is TM joint dysfunction something I'll have forever? And what does a headache at the back of my head even mean? Make sure to watch to the very end, where I will give you a quick fix to relieve a headache at the back of your head. So let's begin. How can I relieve jaw tension with a neck exercise? Your jaw joint, or TMJ, is part of your skull and a part of your face coming together, and there are muscles that attach your neck to your head. But let's not forget about muscles that attach the trunk and your shoulder to the neck, because they also end up obviously impacting the jaw joint. The neck exercise that I find most helpful is much simpler than you realize. Place the middle of your tongue to the roof of your mouth, and as you're holding it, try to glide your neck back and then hold it there. Gliding the neck back allows the back of your neck muscles to hold on to the neck and practice activating those muscles, which when they get weak, the neck goes forward, stressing on the TM joint. There is a disc that has blood supply and nerves that nourishes the TM joint, that when it gets compressed from malpositioning of the joint, it causes pain and tension in the TM joint. Do the next one with me. You can use your knuckles and these muscles over on the two sides of your neck, called SCM. So you can sternocleidomastoid, and so you can get tension in there. What you want to do is you want to use your knuckle and go from the very end, go all the way to the attachment of the muscle to your collarbone, and you're able to relieve some of that tension. But remember, that tension is just not created by accident. It's as a result of malpositioning of the neck over the body. So this just gives you relief, but not a fix. The next one is getting on the muscles of the face. So what you want to do is go to the angle of your jaw right there, and you start going inward and you start massaging these muscles. Again, this is to relieve some of the tension. It's not a solution. It doesn't get rid of the cause, but it gives you some relief. So now let's go to the next question. TM joint dysfunction, is this something that you have to worry about forever? The dysfunction at the TM joint is not something you'll have to live with. However, it seems to not be addressed promptly. Most often people get a mouth guard in an attempt to address the TMJ tension. The reality is mouth guard is simply protecting your teeth from grinding, remember? And not anything more from my experience. It doesn't fix the issue. The tension in the TMJ is typically as a result of malpositioning of the neck and the back of the neck muscles not working properly with the front of the neck muscles. This is typically brought on by overusing devices and the lack of strength in the back of the neck muscles, positioning the neck not in the ideal place, causing restriction of mobility in the shoulders and the neck. I have exercises that I typically recommend to my patients. These are all developmental exercises that we know by studying human babies. If you want me to do those videos, which I've done in the past, but if you want me to do a video on what these exercises look like, comment below and I'll do a separate video on that subject depending on the response I get from you guys. Now let's move on to the next question. What does a headache at the back of my head mean? Headaches at the back of the head are typically referred to as tension headache. This is basically as a result of your suboccipital muscles. These are these tiny itty muscles in the back of your head that basically connect your head to your neck and are involved in the flexion, extension, rotation, and side bending of the head. These muscles, when they get tense, cause suboccipital or tension headache. Now we get to that quick fix to relieve tension in the back of the head, the one that I promised you earlier today. I love doubling up exercises with activities we do. We all go to the bathroom to pee or have bowel movement. So once you've initiated the process, and that's important because you don't want to be bending forward, you want to be more of an upright for better bowel movement and your bladder emptying needs. Once that's initiated and you're almost you're midstream or whatever, you want to place, I'm going to get in the side view, you want to place your elbows on your knees, and instead of just sinking in like so, you want to press your elbows onto your knees and bring yourself up. You want to not be looking up, but you want to just bob your head up a little bit so the weight of your head is not being endured by the muscles of your neck. Every part of your body has to be responsible to carry its own weight. So for the head to expect the neck muscles to hold it up, that's an imposition. Nothing in your body does that. It's all, they know exactly what their roles are. So you want to look up a little bit, so that's this function of your suboccipitals, and then glide your neck back. Position your tongue to the roof of your mouth if you need to, and press down on your elbows and hold that up. That's an activation of the very muscles that when you're not using, your head goes forward, it causes tension in your neck, causes tension in the back of your neck, front of your neck, where you did the SCM, where you did use your knuckles. It creates malpositioning of your head, tension in the muscles of your face, muscles of what's called mastication, you're chewing, and beyond. And you can have issues in these muscles here. All of these create tension in the jaw joint. And when that disc malpositions itself because you're not opening and closing this ball and socket joint, it gets stuck in that joint, and that causes pain there, it causes tension there, it causes grinding there, and you know the rest. I hope you found this video helpful. If you need to contact me because you have ongoing temporomandibular joint issues and nothing seems to be working, give me a call. We can figure this out. Until next time, take care.